Most women think menopause is just hot flashes and stopped periods. They are completely wrong. The truth is, the drop in estrogen triggers silent, long-term changes in your body that you simply cannot afford to ignore. Behind the scenes, this major hormonal shift impacts everything from your bone density to your intimate health. But here is what most people don't know about these hidden conditions. By the end of this video, you'll know exactly what to look for and how to protect yourself. Let me explain what's actually going on. Menopause is a natural biological process, usually happening around age 52 for women in Malaysia. It officially marks the end of your menstrual cycles, diagnosed when you haven't had a period for 12 straight months, as your ovaries naturally stop producing estrogen. In the months or years leading up to this, called perimenopause, you might experience the classic warning signs: irregular periods, sudden hot flashes, night sweats, unexplained weight gain, and even insomnia. Think of it like your body adjusting to a new thermostat. It is perfectly normal, though often uncomfortable. But let's talk about a symptom many patients are too shy to bring up at the clinic. About 50% of women develop atrophic vaginitis. As estrogen drops, the vaginal tissue loses collagen. It becomes thin, dry, pale, and easily irritated, which can make intimacy quite painful. What most people don't realize is that estrogen also maintains a healthy, slightly acidic environment in your body. Without it, the good lactobacillus bacteria decline. This shift in pH allows bad bacteria to thrive, making you much more prone to recurring urinary tract infections and vaginal irritation. The important thing to remember is that you don't have to suffer in silence. This is highly treatable. Using topical estrogen cream or hyaluronic acid moisturizers can plump up the cells, restore hydration, and repair the tissue. Regular pelvic floor or Kegel exercises also help strengthen the area wonderfully. The second major hidden change is osteoporosis, which literally means porous bone. We call this a silent disease because your bone loss occurs without any symptoms at all. You won't feel your bones getting weaker until they become brittle enough to fracture from a simple fall. Estrogen is essentially the protector of your bones. After menopause, bone loss accelerates drastically. Women of Asian descent actually have a higher risk for this. And if you have a sedentary lifestyle, smoke, or don't get enough calcium in your local diet, your risk increases even further. You don't have to wait for a fracture to find out. Doctors use a simple, painless DXA scan to measure your bone mineral density. If your T-score drops below -2.5, you have osteoporosis. Early detection at Klinik Temasya is your best defense against future mobility issues. So here's what I tell my patients to do. First, protect your bones with nutrition. Aim for 1,000 milligrams of calcium and 800 IU of vitamin D daily. Drink milk, eat calcium-rich foods, and get a little bit of morning sun. If needed, we can prescribe quality supplements. Second, keep moving. Weight-bearing physical activities like brisk walking, jogging, or light resistance training are crucial. When you put healthy stress on your bones through exercise, you are actually forcing them to maintain their strength. It is one of the most effective natural treatments we have. Third, let's discuss medical treatments. Hormone Replacement Therapy, or HRT, is incredibly effective for relieving hot flashes and preventing osteoporosis. However, because there are specific medical risks like blood clots, the treatment must be individualized. We use the lowest effective dose tailored exactly to your health profile. You can also make small lifestyle adjustments. To manage hot flashes, avoid thick clothing layers and limit triggers like our spicy local foods, alcohol, and excessive caffeine. In fact, drinking too much coffee can interfere with how your body absorbs calcium, so try keeping it to 1 or 2 cups. I know these physical and emotional changes can feel overwhelming, but menopause should not define you. Think of it as a new chapter in your life's journey. It's a natural transition and a beautiful reminder to finally slow down and prioritize time for your own health and well-being. If you're experiencing these symptoms, don't ignore them. Come visit our doctors at Klinik Temasya for a full health screening. This video is for educational purposes only. Please consult your doctor or visit your nearest clinic for personalized medical advice. If you have questions, leave them in the comments and share this with someone who might find it helpful. If you found this useful, check out our video on women's health screenings.